Velarde and today I'm interviewing Dr. David Dighton, a London and Nicosia-based cardiologist. Welcome, David.
Thank you for inviting me.
Today I would like to ask you about chest pain.
Mm-hmm.
Lots of people have chest pain. Are there different types?
Yes, there are probably three main types. There is, of course, heart pain or tightness, which is the one we're concerned with today. But also there is a feeling in the chest, which is sort of pain that comes from indigestion or heartburn. And then also people injure their chest, and it's pain from the muscles. So we have muscular pain, we have indigestion pain, and we have heart pain, which is not really a pain, it's more of a tightness, but people call it. I'd like to show you a British Heart Foundation advert which shows what chest pain from the heart is really like. And here you see an illustration of a man with a tight belt around his chest. And it's often described as tightness, and I think this is a good illustration of tightness in the chest rather than pain.
If someone has chest pain, how they can tell if it's serious or not?
It can be difficult because it's not usually very severe, so most people underestimate its significance. But if you have a tightness in your chest that gets worse when you walk along, that is probably the best way to pick out the serious forms. If it only hurts when you move, then that's usually muscular. And if it's made worse by eating, that's usually indigestion. So we're looking for the one that is tight and is made worse by moving around or becoming emotional. That usually is from the heart.
Would you expect serious chest pain to be associated with other symptoms?
Yes, it's quite often associated with the feeling of exhaustion and tiredness, maybe even breathlessness. I think they are bad signs, if you like.
What exactly is going on in the heart when it becomes painful?
Well, it's mainly either muscle spasm. The arteries to the heart, the coronary arteries, are actually muscle tubes, and they can go into spasm. Alternatively, it can be an actually blocked artery where the patient is having a heart attack. Both of them cause this tight, oppressive pain in the chest.
And does everybody get pain when they're having a heart attack?
That's a very good question. We now know that probably only 20% of people get pain with a heart attack. So the vast majority of them may have a feeling of tiredness or breathlessness or illness or faintness, but they may not have the tightness in the chest. You could almost say you're lucky to get the chest pain because at least you then know you're in danger.
And how can a doctor be sure that the pain means something serious?
It's not always 100%, but we do ECGs, which quite often show whether or not somebody is having a heart attack or whether it's angina. And we also do blood tests. There are chemicals released by the heart cells which get into the blood and tell us that somebody is having a heart attack. But it can be difficult. It isn't always straightforward, unfortunately. To show you a slide of an ECG that is from a normal person and an ECG from a person having a heart attack, and so you can see that there is quite a big difference here.
What is the treatment for the blocked artery?
Well, first of all, we have to diagnose that they have got a blocked artery, and this can be done in a number of ways. But once we find that the artery is blocked with clot, so that's what blocks the artery, we can give patients what used to be called clot-busting drugs. They can be given by mouth or by injection, or actually directly into the arteries of the heart, which is something we used to do when I worked in Holland many years ago. But nowadays it's changed. We do an angiogram, which means putting a tube into the heart. We then can put a little balloon in which opens the artery out, and thereafter put a stent in to keep it open. So we can dissolve the clot with a drug and then put a balloon in and then a stent. Bit complicated, but that's modern procedure.
And how quickly do you need to do this?
Well, as soon as possible, but in most cities of the world it's quite a long way from somebody's home into the coronary care unit. When I worked in Amsterdam, which is quite a small city, we were able to get people in within 20 minutes, which is really exceptional. So the sooner we get them, the less will be the damage to the heart once the artery is blocked. The quicker the better.
I've heard about angina. What is it?
Well, angina is a pain in the chest. It was first introduced by an Englishman called William Heberden in 1768. That's nearly 250 years ago. And what he described has never really been beaten. What he said was, it was a tightness in the chest produced by exercise, walking, something like that, or emotion, people getting upset. The chest tightness would come on, and it's made worse usually in patients with angina by walking. In fact, that's how we test them. We put them on a treadmill and see if they get tightness in the chest. It's the pain or tightness that is called angina. It doesn't mean they've got heart disease, but it usually does.
And what's going on in the heart with angina?
Well, if it's true classical angina, it means that there's a blocked artery somewhere, which is usually about 80–85% blocked. However, some people can get angina due to spasm, and that can sometimes be due to stress, and their arteries actually can be completely normal, but they are very much in the minority. Usually it means an 80 or 85% blockage somewhere in the coronary arteries.
What's going on in the heart attack?
Well, a heart attack implies that a small portion of the heart muscle has died. If the artery blocks completely, then not enough blood and oxygen gets into the heart muscle, and it literally will die, releasing chemicals into the blood which we test for. One, of course, is called troponin. There are a few others as well, but these are tests, blood tests that doctors do to detect the damage of the heart muscle. That's what we mean by a heart attack.
And can heart attacks be prevented?
We do our best, but we don't always achieve it. There are two things we have to achieve. One is to stop the furring, or which we call atherosclerosis, or cholesterol build-up in the arteries. And the second is we have to stop clots of blood forming on these rough bits inside the arteries. So in order to stop the furring, we use drugs like statins, which lower the cholesterol and stop the furring of arteries. And then secondly, we have to stop the clotting, and aspirin is quite good at that. So the basic treatment would be statins plus aspirin in a small dose every day. And we have evidence that that does stop heart attacks to some extent, maybe even up to 70%. Not all of them, but quite a few.
Are there any other medicines that help to prevent heart attacks?
Well, a lot of people believe in fish oils. These are omega-3 oils, and also oils that are in plants, nuts and seeds. These are omega-6 oils as well. It's a bit controversial, but they probably do help. The Mediterranean diet, which contains not just those oils, but things like selenium and zinc, also works. Quite an important study was done on the Mediterranean diet, which showed that it reduced heart attacks, second heart attacks actually, by about 70%. But there are not many studies showing this, so we think Mediterranean diet is important. We think maybe supplementation with a few of these things like omega-3s and selenium might have an effect. Not proven at the moment, but there is some persuasive evidence for it. Then we have exercise. A lot of people believe in exercise. The original studies on exercise showed that you had to do serious exercise. Rowing, weight training, marathon running, playing squash, not just walking. But there is now evidence that walking every day, like walking the dog, can have some effect. There's also, of course, the avoidance of stress, but we'll come on to that.
Has stress anything to do with why people get chest pain?
This is a really interesting question because it's very controversial for doctors to discuss. But patients seem to accept absolutely that stress is a major factor. So we have a bit of a difference of opinion. But stress in animals certainly can cause heart attacks. If you stress them in laboratory conditions, you can make them have heart attacks. So we're fairly sure it's a big factor. How does it work? Well, stress causes adrenaline-like production. That can increase the furring in the arteries, it can increase clotting, and we're fairly sure there's a connection. This has partly also been proved in a way by giving what are called beta blockers. These are things that stop adrenaline working, and they do reduce the number of heart attacks that occur. So I think the simple answer is yes, stress is a big factor.
And what sort of stresses are relevant?
Well, stress is like beauty, it's in the eye of the beholder. For some situations aren't stressful to one person, but they are to another. But I think one of the main common features of stresses that are effective and bad for the heart are where the person loses control, where they've lost control, there's no way out of a situation that they can see, and it's that really brings them to the point where something has to give way. If they're a migraine sufferer, they get migraine. If they have heart trouble, they get angina, that sort of thing.
Is sleep an important factor?
It is for people where stress is involved. The more stressed people are, the less well they sleep. But there are, however, people with such bad arteries that stress and sleep don't matter at all. If their arteries are furring very rapidly and they reach the point where their arteries are 90 or 95% blocked, they don't need a lot to give them a heart attack. And it's in those sort of cases where stress seems to be less relevant. So if somebody isn't sleeping, then it's possible that they are quite stressed. And if they do have heart disease in their family, or they have evidence of personal heart disease, that could make it come sooner.
So am I correct? Chest pain is not the only symptom of heart troubles?
No, as I said before, it probably only occurs in 20% of people with heart trouble, but breathlessness, I think, is more common, and it occurs in about 80 or 90%. It gradually increases over the course of a year. But then so does tiredness and general unwellness. They're too non-specific to use, but when somebody does have a heart attack, it's interesting that if you ask them or you ask their family, they will tell you that the person was stressed, they were looking tired, they were looking older, they just weren't well. It's quite interesting that these precede an actual heart attack, but of course being tired is a common thing. Not everybody with tiredness by any means is going to have a heart attack, so we can't really use it. But breathlessness, I would want to emphasize, breathlessness is one of the most important symptoms, I think. It must never be ignored. It always means something, even if it's only unfitness or maybe chest or lung disease, but it always means something. So if you are becoming more breathless, seek advice from your doctor. That's very important.
So if someone is getting more breathless, what should they do?
Well, if they're getting more and more breathless over the course of a few weeks, I think it's really essential to be tested. There are pitfalls here though, because an ECG at rest may not show anything. You have to do an exercise test to see how breathless they are and to see if the heart tracing does change. Even that may not change and they can still have heart disease. So you might need to go on and do some other heart scanning. There's something we use called stress echoes, and sometimes even angiograms, but we have a number of tests to define if these people do have heart disease. Again, this is a difficult area, a screening area, again not looked on very favourably by all doctors, but I think it's our duty to rule heart disease out in somebody who's getting more breathless.
Why an artery scan?
Well, the whole basis of coronary artery disease, angina and heart attacks is that the arteries fur up with cholesterol. The arteries actually make their own cholesterol. Some is deposited from the blood, but it's mostly made in the artery. And if we can detect whether a person is doing this furring, then we know that they're at a much higher risk of having a heart attack. So we can scan the carotid arteries, we can scan with ultrasound, which is simple. We can scan the heart arteries with x-rays, a CT scan, or we can even do an angiogram which shows the inside of the arteries. But because the basis of coronary artery disease and heart attacks is the furring process, we really ought to be looking for it. I myself feel that some sort of scan is absolutely essential when somebody has a family history of heart disease, because the blood cholesterol can be misleading. So if somebody's got a family history of heart disease, their father had a heart attack, I like to scan their carotid arteries first. If they are bad, then we do heart scans and so on. So yeah, get screened if you've got a family history of heart disease, and get your arteries scanned. Very important. Let me just illustrate this with some slides which show you several types of furring in the arteries. There is one with a lot of chalky material in, and another one here which is mainly cholesterol, which is almost semi-solid, a bit like soap. Both of these partially block the arteries and will give rise to angina or heart attacks even if it carries on.
Is coronary heart disease more inherited than acquired with a bad lifestyle?
I think so. I think patients believe that it's what they eat, but I think the evidence is that it's 95% is probably inherited. So if you have the genetic component and you eat high fat foods or don't exercise, it might then bring heart disease on. If you do not have the genetic inheritance, I'm not sure that there's anything you can do to give yourself heart disease. You have to have the genetic structure first, and then the other things will make it worse. But without the genetic inheritance, I'm not sure, but I doubt that you can get heart disease if you do not have it in your family. So that's really an important aspect to this.
Well, you cannot change your genes, so what good can you do?
Well, genes really are the blueprint for the body working, and they work through a whole cascade of different metabolic or chemical processes within cells, and pharmaceutical drugs can stop those processes. So statin drugs can stop cholesterol building up. Exercise, because it changes your metabolism, can also change these processes. It doesn't take them away, but it can stop them exerting themselves. Whether food can do it, because food doesn't really alter your metabolism, I think is an interesting question. However, I have to say that the evidence on the Mediterranean diet showing a reduction of heart attacks suggests that it can. So maybe there are good things in food which stop heart disease and bad things in food which make it worse. But we have done another YouTube presentation on that if people are interested, because it's quite a difficult subject to deal with. What foods are good for you, what foods are bad for you, is another subject, and they can see this if they want to search and find our other presentation, because it's a bit complicated to talk about now.
So, in conclusion, who should be worried about getting coronary heart disease?
Well, I think the family history has got to come first. You know, if your father had a heart attack, if one parent has a heart attack, your chance of getting coronary disease is 25%, 1 in 4. If both your parents have had heart disease and they have 10 children, then 8 of those children will have heart disease. So it's almost inevitable, not quite, but almost inevitable. That comes first. Does a raised blood cholesterol tell you you're going to get heart disease? Well, it's a 60-40 relationship. It's not a really good test, the blood cholesterol, unfortunately. It's okay in large populations, but in individuals it can be misleading. So I reject that myself. I go straight for artery scanning in people with family history, because if they've got a build-up of cholesterol in their arteries, then their risk is quite high.
And if someone has already had a heart attack, what can they do?
Well, I think we need an overall approach. Lifestyle, like a bit more exercise, giving up smoking, losing weight. These are all quite important factors. They may not be the biggest factors, but they are important for the general health. And then, of course, they should have a statin to stop the progress of the furring of arteries. Because if the arteries continue to fur, they're most likely to have yet another heart attack. So I would say that they should get their arteries scanned regularly to make sure the statins they're taking have actually stopped the progress. That's, for me, one of the most important things.
Is there any other advice, Dr. Dighton?
Yes, I think there's a lot of things that people can do for themselves, and they must change their mindset to a healthier one, I think. This can be prevented to a great extent, but they have to be willing to do it. Yes, they can take aspirin, small dose of aspirin a day, they can take their statin drugs, but they have to think really of their general health, you know, being fitter and giving up the things that are bad for them, like high-fat diets and smoking. So yes, it's a question of changing their philosophy of life, really, changing their lifestyle, in short. I think it's important, yeah.
So, in conclusion, if you have chest pain and breathlessness, you should get checked.
Yes, absolutely. I think a screen of some sort, not just a doctor listening to you with his stethoscope, but some more in-depth studies like ECGs, exercise tests, artery scanning is essential, really, if you're to prevent heart attacks.
Right. And can patients contact you?
Yes, we have a website, which is heartsense.com, and also there's the Cardiac Centre UK.co.uk in Europe and UK. if they want, and they can send us emails as well, but that's through the website, of course.
All that remains is to thank you for watching and Dr. Dighton coming to help us understand about the chest pain.
Thank you for inviting me in.
This is Ilona Velarde saying goodbye for now. Please note that our other videos explains about other heart symptoms. If you would like to have more information about this subject, why not buy or download our Heart Sense book, which is easy to read and contains useful information about the heart and the best diet to eat. In case you would like to read something more technical, you can buy our Eat to Your Heart content book from our websites. And you can also download this very short brochure, Worried About Your Heart, which explains many details about heart problems and which is available in 4 languages: English, Greek, German and Russian. Don't forget to purchase our Heart Sense supplement, which is essential to even the best diet. Soon we will also have Heart Sense tablets, which will be available on our websites. All our products and information are available on our websites, heartsense.com.cy and thecardiaccenteruk.co.uk.